Welcome to the Connected Care Blueprint, architecting the digital nervous system for modern healthcare contact centers. This video offers a strategic briefing for healthcare executives. Healthcare has the most robust data, but struggles to deploy it where patients need it most. 97% of the world's healthcare data is unused, contributing to significant system waste, including $150 billion lost annually to no-show appointments in the US. This systemic friction erodes trust, as patient expectations for easy, fast resolution are not being met. Digital native demographics are redefining acceptable care, vanishing the margin for error. We see a loyalty cliff, where over 70% of millennials and Gen Z are unlikely to return after one bad experience. A navigation deficit means half of Gen Z patients don't know where to find care. The virtual shift demands seamlessly connected virtual and in-person care. We can map friction points that delay diagnoses and increase costs. The remedies involve 4 key areas: embracing patient centricity by pivoting to business-to-patient models, extending digital access with cloud-based data availability, maximizing capacity through AI-powered self-service scheduling, and empowering actionable information with omnichannel knowledge hubs. There is a significant architectural gap between premises-based legacy systems and an intelligent cloud ecosystem. Traditional systems rely on manual scheduling, siloed channels, and fragmented data access. The Intelligent Cloud Hub offers elastic, AI-optimized capacity, true omnichannel routing, native EHR integration, and rapid compliant scaling. Native EHR integration transforms the patient access center from a bottleneck into a real-time connection hub. The core takeaway is that by embedding contact center capabilities directly into systems like Epic, organizations eliminate patchwork fixes and empower agents with one-click dashboards, improving patient scenarios significantly. True omnichannel communication allows patients to switch channels seamlessly without losing medical context. This creates an invisible digital nervous system. As a patient interacts across the app, email, voice, SMS, or web portal, the system logic works in the subsurface to log data, analyze text, route communications, and track self-service resolution. Intelligent automation can be deployed across the entire care continuum. Key areas include AI-powered scheduling, intelligent routing, virtual health assistance, billing and exemption support, real-time sentiment analysis, and automated compliance. These applications streamline processes and enhance the patient experience. AI-powered self-service returns massive volumes of clinical time back to actual patient care. For radiology, AI implementation saves 78 days in triage time and 41 days in reporting time. This operational lift also allows healthcare agents to handle 8% more simultaneous interactions, expanding clinical capacity without increasing headcount. To prepare for agentic AI, healthcare must structure data governance today. While the agentic horizon of autonomously reasoning AI is still on the periphery of clinical use, the current state utilizes conversational and generative AI to automate routine outreach and routing. The strategic mandate is to build the cloud infrastructure required to responsibly harness agentic AI when frameworks mature. A case study with a leading US radiology specialist showcases the power of overhauling B2P routing. By deploying an intelligent cloud platform featuring conversational AI agents for intent-based routing, the organization unlocked $4 million in untapped revenue and $400,000 in direct labor savings, reducing call abandonment to under 4%. The engine of continuous improvement moves healthcare from episodic interactions to connected care through a 4-step cycle: listen, analyze, apply, and tailor. AI in healthcare does not replace human empathy. It removes the friction that prevents it. Building a digital nervous system ensures your organization is ready to scale the future of connected care.